Let's get to another health story making waves today. Whooping cough is surging across the U.S. Case levels are now 5 times higher than they were at this time last year. The CDC says this is also the highest number of whooping cough infections since 2014. So why are cases increasing?
Going up. So multiple reasons for this. I think one of them is waning immunity. So we know that the whooping cough vaccine, it's really effective 1 to 2 years after you get it. But then the years after that, it starts to decrease in effectiveness. And for adults, we get it once every 10 years. And so we notice that the immunity is not as good. I think the other big one is that bacteria that causes whooping cough, it's evolving. Just like other bacteria and other viruses, they get smalt, they can evade our treatment and our vaccines. And so we're seeing that as well. And then of course, we're more active. We're getting back to pre-pandemic activities, social interactions, people are out and about, and of course that spreads the whooping cough as well.
It gets to become more contagious.
Exactly.
So what can people do to stay safe?
Yeah, so the number one thing is get vaccinated because of course that makes a big difference. And I always tell people this, stay at home if you are sick. Avoid work, avoid daycare, avoid school, because that's where we spread this. Whooping cough is highly, highly contagious. And the other really important thing is see a doctor if you have symptoms. It's a little insidious because people will present like a typical cold and cough for about a week. And then after a week, they actually start to get that whooping sound.
Oh.
The cough gets really bad. Sometimes people even throw up from getting that cough.
Wow.
There is antibiotic treatment for it. So we want to know if someone has it so we can treat them. And actually, just as importantly, if somebody is sick, we can treat your entire household. So we can prescribe antibiotics for everyone in the household to prevent them from getting sick as well and spreading the infection.
And I'm just curious, how often should we get this vaccine? Who should be getting it?
Yeah, so right now, anyone can get it over the age of 2 months. So definitely babies are at highest risk. When they get whooping cough, they have trouble breathing. They end up in the hospital oftentimes. So of course, children should absolutely stick to their vaccine schedule, get it starting at age 2 months. Teenagers get a booster at around 11 to 12 years. And then for adults, it's every 10 years with our Tdap vaccine.
All right, great to know. Thank you so much, Natasha. And I know we're going to be talking about 2 more medical headlines in our next half hour.